session. We are waiting for Instagram to...
Hello, madam.
Hello, sir. Hello, madam. We are waiting for Instagram to inform more people about our live session. It takes a little while to for it to let people know. Meanwhile, to everyone who has joined, a very warm welcome in today's live session, which is on healthy sleep habits in little ones. So cultivating healthy sleep habits in especially infants and toddlers is very important, as sleep is a fundamental pillar in the growth and development and overall happiness of little children. But we do understand that establishing a healthy sleep habit can be a little daunting, and it comes with its own set of challenges and uncertainties as well. And precisely that's why we have today with us Dr. Guru Prasad Peruri. And with Sir, we are going to delve into the depths of understanding the unique sleep patterns and the needs of infants and toddlers. Sir is a renowned pediatrician and neonatologist working in Anu My Baby Hospital, Vijayawada. He has graduated from the topmost colleges in India and has also bagged gold medals as the best outgoing student. Sir is a child-friendly doctor and believes in prescribing minimum of medicine, especially when it comes to antibiotics and minimum blood tests to be done for babies. So I think there is nobody better than Sir to help us navigate this session today. We are thrilled and honored to have you here, sir.
Thank you, madam. Thank you for your kind introduction.
So let us just delve into the session. I see there are a lot of people who have joined us already. I'm sure they will be waiting to start the session. So first of all, I just want to understand, how is establishing sleep patterns, especially for infants and toddlers? I would say sleep routines, not patterns, but rather routines for infants and toddlers. How does it contribute to their overall well-being and development?
It's a very nice question, actually. Why to have a very good sleep routine is important for, especially for children. So we all know, for example, most of the brain development, or in fact any physical development, happens during the sleep only. Children especially are in a phase of very rapid development phase. So what they see in the mornings, or what they hear, or what they learn in the morning, so they need some time to consolidate everything. So for a proper brain development, especially sleep is necessary. During the sleep time, there are so many connections happening in the brain, that is known as a number of synapses formation, that is necessary for the consolidation of memory and more learning. So, and also the normal brain growth, also a proper sleep is necessary. Apart from that, when the child has a proper sleep pattern, there are a lot of hormones producing from their brain, especially something called as a growth hormone, which is necessary for your body growth, bone growth, and also for the faster tissue repair. So these things happen during the sleep. Apart from this physical development and the brain development, immunity. So a lot of the substances, or what are the cells that are responsible for immunity, they usually develop, or they are produced during the sleep pattern. So this is the most important things. That is why they should have a proper sleep routine. Apart from this, let us assume a child or a baby is not having a proper sleep pattern. You might be noticing that they will have some behavioral and emotional problems also. For example, children who sleep very less, they have a very difficulty in attention, or what you call in focusing. So they may develop some behavioral problems like aggression, irritability, temper tantrums, or they may have emotional outbursts also. So to prevent all these, proper sleep routine is necessary for children.
So this is very, I think it's an eye opener. So usually people just relate sleep with rest, but it is, it just tells you that not just rest, but it is actually overall physical, mental, emotional development of a child, which is happening during sleep. I think this was an eye opener for me as well. So when we talk about sleep, there are a lot of times that we hear REM sleep and non-REM sleep. So what exactly is that? how do they impact like children and infants,
Okay.
basically? What is what is this context in
Okay.
terms of children and
So
babies?
this is also one more interesting question, but the terms like NREM, REM, so most of the parents, it might be a new term to them. To make it simplifying to them, I'll just give the abbreviation, and I will make them understand in a very easy language. First of all, whenever we sleep, there are two stages of sleep that is called as NREM and REM. NREM means non-random eye movements. REM means random eye movement sleep. So for understanding, we generally start with NREM sleep and we go to REM sleep. And this is called as a sleep cycle. So in when we are sleeping the whole night, there is a multiple sleep cycles happening, like NREM, REM, NREM, REM, like that, multiple sleep cycles happening. So NREM, when you go to NREM sleep, there are three stages of NREM. Stage one is like just baby is getting drowsy. So if you speak to the child or when they hear to some noise, they can easily disturb from that sleep. And stage two is somewhat between a drowsiness and a deep sleep. So in such time, they may not be easily awake, but still this is considered a lighter form of sleep. So in NREM, stage one and stage two are lighter sleep. And NREM stage three, which is called the deep sleep. This is the most important form of sleep. Why? Because all our health benefits of sleep, what we have discussed, like hormonal production, growth hormone production, these all things happen during this stage three of NREM sleep. This is called as a deep sleep. Okay. And coming to the REM sleep is nothing but it is called as active sleep. So even if the child is sleeping, this in the REM sleep, the brain is in the highest active phase. So in this phase only, whatever we have discussed, like the synapse formation, consolidation of whatever things the child has learned, memory formation, learning capabilities, all these type of things happen in this phase. So when you see a child sleeping, so sometimes they sleep very calm, and in the middle of the sleep, you notice that they may have eye movements, or their breathing pattern becomes irregular, their heartbeat tends to rise. They may have some very small minor movements at that time. Then you should understand that they are in that REM form of sleep. But whatever we are discussing, this type of stages of REM and REM will take some time for a baby to develop. It usually doesn't happen in the first 3 months. Only after 3 months of life, slowly this type of sleep patterns tend to develop. There is a difference between a sleep cycle of a child and a sleep cycle of an adult. So we will now discuss what is the difference between a baby or an infant or a toddler and an adult.
Yes.
So, okay. So whenever we are discussing, like for example, most of the parents ask me a question like, how many hours of sleep is necessary for a baby? So that is something a tricky question. In the first 3 months, most of the times babies are sleepy. Like they sleep for nearly 14 to 17 hours per day. Once they cross the 3 months, the duration of the sleep decreases, and usually it is for 20 hours. And in children, mostly the sleep is REM sleep. Their brain is very active because a lot of all these things are happening. Whereas compared to adults, like for us, REM sleep is only 20% of all our sleep. But in children, the REM sleep is nearly 50%. Okay. So for a child to transfer from this baby type of sleep pattern to adult type of sleep pattern, it usually happens around 2 to 3 years of age. Because of more REM sleep, in fact, what I say is they have a very deep sleep is very small and active sleep is more in babies. So they tend to get disturbed very easily. So that is why they wake up very frequently in the night times.
Difference in the adult sleep pattern and the kid sleep pattern. What is the ideal nap duration for babies, and how many times should a baby nap? And also, then I have seen that there is a difference when it comes to a 3-month-old baby and a 6-month-old baby, and then progressing to like 1.5 years when the baby moves ahead at 1.5 years. So there is a difference. What is exactly the nap pattern which should be followed for this age-wise?
So napping, first of all, we should understand naps means the time where baby sleeps, especially in the daytime. So what we are discussing in the naps in the, like, can we allow the baby to sleep during the daytime? how much time it is necessary for baby to sleep.
Right.
That is the meaning of a nap. So generally for the first 3 months, it is like we already discussed, baby is sleeping most of the time. So baby can nap up to 6 to 8 times also in the first 3 months. They sleep, they take the feed, they sleep for 2.5 to 3 hours, and they again get up. And each nap can last from 30 minutes to sometimes to 2 hours. As the baby grows, you will be noticing that this nap, the duration of the nap, number of naps will come down, and they tend to have a very good sleep, especially in the night time. Like initially they are getting like 2.5 or 3 hours, and gradually as their age is increasing, that sleep duration, like it can increase up to 4 hours, 5 hours, or something like that. So a proper predictable sleep pattern usually starts from around 4 to 5 months of age. Once they cross this 3 months period, usually they have a 3 naps, especially like if you tell early, like morning they have 1 nap, in the early afternoon and in the late afternoon they have 1 nap. This is common for like 3 to 6 months period. Once they are crossing that 6 months period and coming to 9 months to reaching to 1 year, they usually have 2 naps. Each nap can last for 2 to 3 years. After 1 year, generally 1 to 3 years children, generally they have a one single large nap, like 2 to 3 hours, especially in the afternoon time period. But whatever I am telling, these naps, these are all like a textbook things. This cannot be same for all children. So there is variation between children to children, and some children tend to have short naps even in the morning time also. So in this session, so mothers or people who are listening to the session should not feel that baby should not have more than 1 nap and you have to wake the baby. So you should follow, as there is difference in baby to baby. So you should follow as per your baby. But this is the general things which happens with most of the babies.
Absolutely. So then these would be basically, it comes to parents as challenges, you know, I'm a lactation consultant myself. I come across a lot of times when women come to me saying that my baby is not sleeping at all. I'm so tensed and I'm so worried. I'm also very tired. So that will come to mothers because, you know, obviously when their babies, they have been sleeping maybe 14 hours a day, and then suddenly it is dropping. We call them sleep regressions. So how to cope up with that sleep regression? What do you do if a baby is getting up frequently in night? Is it okay? Is it normal for babies? Until what age would a baby keep getting up at night? These are the questions that I come across very frequently.
Coming to the sleep regression. Sleep regression means baby is having a one type of schedule and he's deviating from the schedule. That is called as a sleep regression. So there are some physiological points where sleep regression is expected. For example, around 3 months, around 8 to 9 months, and again at 18 months to 2 years, there is normally a sleep regression that can happen to the babies. That is a part of development that can happen. So in this session, as we go through this session, we will know like how to establish consistent bedtime routines, or how to establish a safe, sleep friendly environment, and all these things we will be discussing. But as a parent, especially for the first time parent, it is very difficult for them to get in the night time. So some tips what I have faced, like as a parent, what I came to know after that thing is, so first of all, you fix in mind that there is nothing like mother has to sleep in the night. In the morning, you will take care of the baby. So you follow the sleep schedule of the baby. So whenever baby sleeps, you sleep. And whenever baby gets up, you have to get up and feed the baby. That is the first thing. Second thing is, try for proper breastfeeding. So if it is when you are not having a proper breastfeeding, or whenever you are feeding a formula milk, it will be difficult for the parent getting up and making formula preparation, bottle cleaning, and all these things. So if you try for going for exclusive breastfeeding, it is very happy, like you just feed the baby, you leave the baby, you can sleep and you can get up along with the baby. That is the second thing. Third thing, what I noticed why the mothers are in a stress is because of so many myths and so many advices from the family members. So there is a lot of conflict happening. Like one people will be telling you should not eat those things, and some grandma will come and tell, no, baby's having stomach ache, you should give those medicine. So all these things are happening in the family. And in India, we have a culture like most of the breastfeeding women are deprived of proper food. There are a lot of food restrictions the family keeps on them. So it is very important to understand that there is nothing like food restriction, that any complaint, mother can take any type of food, be it vegetarian, non-vegetarian, even if fruits, vegetables, curd, whatever it is, she can take like a normal person, like what she was taking in the pregnancy, she can continue with that food. So most of the time I see like this food deprivation also pushes the mother into depression, apart from this baby crying and irritating most of the times. So most of the mothers will have this some form of stress. So if they follow these things like following the sleep schedule of the baby, having good food, taking some rest, proper sleep and all those things, and follow whatever your doctor tells instead of whatever your family is telling or some other people are telling, then most of the times mothers will be happy. And you should remember that this will pass on. Usually by 3 months and all those things, you will be accustomed to a proper schedule.
Right. That's actually very nice to know, sir. And I completely agree that there are peripheral things apart from just the baby waking up in the that can tire out a mother. Sir, you were just talking about establishing sleep-friendly environment. Can you please shed some more light onto it? How to actually establish a sleep-friendly environment for babies? What is the noise level, the lighting, the temperature, ambient temperature? That's
okay.
What we would like to know.
So, first of all, I will tell the important, like, why is it important to establish a consistent bedtime routine? So I will tell a famous science experiment. This was conducted on dogs. Science students, most of them will study. This is called as Pavlov's experiment, where they noticed that in front of the dog, they tried to ring the bell. They noticed nothing. There was nothing change happening. Then they offered food to the dog. Then they noticed that there was salivation and dog was enjoying the food. Next time, whenever they are offering the food to the baby, food to the dog, they were simultaneously ringing the bell. So they habituated the dog like that, like whenever they are offering food, they're ringing the bell. And later they notice that even without offering food, whenever you ring the bell, there is salivation happening to the dog. That is like you are training the dog in such a way that whenever these both are associated, something like that. The same thing when we apply to the babies. So if you follow a consistent bedtime routine. So suppose you are making the child to sleep at 8 p.m. every day, and you are having a proper place, like not like you are having a bedroom. You take the child to the bedroom every day and make him sleep at the same time. So it is like a normal thing that will happen. Like whenever you take the child, or whenever the clock strikes 8 o'clock, the baby tends to have a proper sleep. This is one of the important thing to establish a consistent bedtime routine. The advantages of having this consistent bedtime routine is there is a clock inside our body that is known as circadian rhythm. So to circadian rhythm, that is why we sleep in the night time, because the internal clock will produce a hormone called as melatonin, which is responsible for your sleep. So whenever you are adjusting your cycle with that internal body cycle, so it is very easy for the child to get into the sleep. That is like there is a very smooth transitioning happening. Other thing is the quality of the sleep. So quality of the sleep will be good, that they don't get up intermittently, or when they get up in the morning, they are not tired, they are fresh, because they are adjusting their sleep cycle according to their internal clock, that is the circadian rhythm. So that is important. So coming to the room, like how you should, what are the tips for a sleep friendly environment? First of all, it comes to the temperature. Temperature of the room should be like around 22 to 25 degrees, but this is not a hard and fast rule. It depends upon the room size. It depends upon the type of AC you are using, or you are using fan or cooler or something like that. For practical purposes, whenever any adult, like if I am going and sitting in a room of a baby, I should not feel sweaty, or I should not feel chills, and I should not put a blanket. So I should feel comfortable sitting in that room. That temperature is okay for the baby. So that is one thing. Second is the lighting. So it is best thing to have a not a transparent thing like a complete blackout curtains or blinds to be present in the room, so that whenever you are entering the room, you just close the curtains and you keep the room dark, and you can have a very low dim light. Okay, don't try to put some bright lights. Bright lights are known to inhibit your melatonin hormone, so that baby may not get sleep. So you should have a very small dim light. Coming to the sounds or noise, whatever we are speaking, it is like most of the time whenever a child gets up or whenever child is sleeping, we tend to talk with the baby or sing like that. But actually what happens is by listening to your voice or noise, child tends to get up rather than going to the sleep. Instead, you should have something called soft music or lullabies or white noise, something like that. Like that, if you should try to maintain in the room. And coming to the bedding, so it's very important that you should not have a very loose blanket like things. It should be like what you call it, like a sheets, and it should be tucked below the elbow, below the underarms of the child. So it should not cover the face of the face of the baby, and it is not advisable to use loose blankets or pillows because there is some risk of suffocation happening. Next, coming to the babies, and I will tell you like some what are the tips you have to follow for the babies and what are the tips you have to follow for the infant and toddlers. Coming to the babies, most of the times for babies, if you feed them adequately and before after feeding, immediately you change the nappy, and you can just swaddle them. Swaddling is like a properly covering covering them with a cloth, not too tight or not too loose. Then they will usually sleep for 2 to 3 hours. And other thing is you should follow something called safe procedures. Like don't make the baby sleep on the abdomen. You should lie them on the back position only, at least till 1 year. And other things which are not allowed for babies are like in the baby crib are pillows, loose blankets, or stuffed toys. These are not allowed for babies because there is a risk of suffocation happening on them. And coming to the infant and toddlers, the important thing is to have a consistent sleep routine. Like you should follow the same time of sleep every day. Suppose if you're thinking like this is Saturday or Sunday, I will let him play for some more time. Then what happens is you are disrupting the schedule. So if you maintain the consistency, like same thing, even whatever day it is, so that is the key. Consistency is the key. That is number one. Number two, whatever we have discussed, like at the atmosphere, giving them a good atmosphere to sleep. The third most important thing is the screens. Like we have the habit of showing YouTube videos or rhymes or something like that. So it is very strictly prohibited. Like at least 1 hour before sleep, child should not have any exposure to screen, because the blue light that is coming from the screen can inhibit this hormone, melatonin hormone, and they may face difficulty in sleeping. And so these are some of the things that you can follow.
I think this was very amazing. The tips that you have mentioned will be useful for all parents, and in fact, I think this goes beyond toddlers also. Inhibiting screen time, inhibiting noise, set bedtime routine. I think it will go a long way for not just toddlers but even older kids for as well. Apart from that, there are a lot of school of thoughts when it comes to sleep training. So there is something called as we like to train our babies to sleep. Now, people have different views on it. Some people believe that they should start co-sleeping as soon as the baby is born, and some people believe that as soon as the baby is born, they should have a crib of their own and they should sleep on their own. Also, there is something called as they say that the baby should learn to self-soothe. So, at what age would a baby learn to self-soothe? And what is your take on those sleep trainings, those various methods that people follow? As well as co-sleeping, as well as
okay, coming to the co-sleeping is common in our India. Like we all have the habit of sleeping along with the baby. But coming to the recommendations worldwide, like American Academy of Pediatrics are considered the gold standard worldwide. So they don't allow co-sleeping. They say you should not sleep with your baby. You can put the baby separately in a crib. In fact, they follow like keep the baby in a separate room altogether. They don't have allow the baby to sleep in them in their room also. But in India, it may not be possible because of our all cultural things which we were following very long ago. So at least like co-sleeping at least should be avoided in the initial phases, especially if parents are very obese or there are habit like if they are having the habit of deep sleep, like they don't tend to get up for the noises. Such people and those people who are having like habit of drinking alcohol or other things. So these parents especially should not or should avoid co-sleeping with them. And better is keep a crib beside you and allow the baby to sleep in the crib. That is regarding the co-sleeping. And as baby becomes bigger, like after 3 months or 4 months, then slowly you can transform, like you can change that crib. So one thing is initially you increase the distance between your bed and the crib. Next, you can change that crib to the another room. As baby becomes big, you can change from crib to the bed. Something like that you can go gradually. Coming to the sleep training methods, there are many methods, but I will be explaining about 2 or 3 methods, which are just generally commonly most of them follow. The first one is called as extinction method or cry it out method. This is like it is very weird to hear, but this is like you keep the baby in a separate room, let him cry, leave him, don't attend him. Gradually he will sleep on his own, because what is the school of thought behind this type of method is each child should know self-learn how to self-soothe himself. So this is one type of method, but I think this type of methods in India it is not possible, because we are more emotionally connected to children and our family members may not allow these things. So this is not possible. What we can follow is something called as a Ferber method. Ferber method, or it's also called as a gradual extinction method. This is like, for example, whenever your toddler or infant is is crying, so initially you attend him like you allow him to cry for 2 minutes, then you go and attend to him. Then gradually next day you increase the time like 3 minutes or 4 minutes, and gradually 5 minutes. Sometimes like the number of check-ins going and checking in the room you can decrease slowly, rather than this altogether as a sudden. You can gradually extend that thing. This is known as Ferber method. That is one method. Or other method is called as a fading method. Fading method means, for example, your baby is habituated to sleeping in a rocking. While you rock the child only if he sleeps, or in the swing you allow the baby to sleep. So it takes some 10 to 15 minutes for baby to go into the sleep, especially when you're rocking. Then what you do is, instead of 15 minutes, you do 10 minutes. Next day, you do only 5 minutes. Slowly, you increase the time, like gradually you're fading. This is known as fading technique. So gradually, you can follow either of these techniques. Yeah.
Right. So any particular age that babies will learn to self-soothe, or is it baby to baby and does not have any scientific evidence to it?
One thing is, at least when you want to teach the babies, the minimal age is at least at 3 months, because in the initial 3 months this sleep cycle is not established, and babies tend to get up very early, partly because of their rapid growth. So they are in hunger every 2 to 3 hours, they need feeding. Once they cross the 3 months, so they tend to sleep for more hours, like 4 to 5 hours, and they tend to develop the self-soothing habits. So when you want to teach your child a self-soothing or sleep routine behavior, at least you can start after 3 months, not before that. And important thing, whatever methods I have told, whatever we are discussing, it is independent for, and it is different for different babies. You cannot have a single rule for all babies. So basically, you should analyze your child. You should see him and decide which method it fits to him, and then you can try that. There are some techniques like some difficulties parents may face, and the remedies I will be telling. For example, you are having difficulty in making him falling asleep. Like many parents will say, like, my child doesn't sleep till night 12 o'clock. It sleeps only at 10, from 10 to 12 o'clock. My baby doesn't sleep. But once he sleeps, he is comfortable. So what can we do to make him go into sleep earlier? So in such conditions, what I say is, so whenever your child is sleeping at 12 o'clock or 11 o'clock, first make a sleep routine. Like at 8 o'clock itself, you take the child into your bedroom. So as we have mentioned, keep the lights, noise, or the environment, like it should be cooperative for him to sleep. For infant and toddlers, what we can do is, you can make them have a proper one type of sleep routine. Like example, 8 o'clock, you take the child into that room. Before taking into the bedroom, you can offer him a small banana or yogurt or a curd, which will induce sleep to them or better sleep for them. And then take them to the washroom, tell them to brush their teeth. This helps in establishing a proper brushing routine. And then you can bath them with a lukewarm water, not too hot water, just with a lukewarm water. And then, or you can give for small babies, you can give us massage also, oil massage, gentle oil massage, and then bathe them with lukewarm water. And then give them like loose fitting clothes, and then bring to the bed. And you make a habit like giving a small music, or you can use like bedtime storytelling to them. So slowly you start conditioning the child. So at 8 o'clock, once you start reading this bedtime story, slowly when you follow this routine, they tend to sleep. Suppose you are not allowing co-bedding and you are allowing the child to sleep in a separate room, let us assume. So there are times like child tends to get up, child tends to cry, and all those things. So at that time, what you can do is you can follow some methods like what we have told, like gradual extension method or gradual retreat method. And for self-soothing the baby, you can offer him like, you can make him sleep with his favorite toy once they come to this toddler phase. Or you can give a teddy bear, stuffed toy like a teddy bear, or some favorite cartoon character, whatever it is. Or whenever you feel like baby is crying, don't go immediately and pick the baby. That is a wrong thing every parent will do. Just wait for a few minutes. Most of the times after 5 minutes or 10 minutes, baby generally sleeps by themselves. Only when you lift the baby, then he comes to his consciousness, and then it is very difficult again putting the baby into the sleep. So just by your voice or just patting on them, you try to make them sleep instead of lifting the child. So these are some strategies you can follow.
Okay. So I think this has been a very, very informative session today. I'm sure that our audience must have learned a lot. We have discussed so many things with you, and you have educated us on the type of sleep that babies have, how it is different from adults, how important it is for babies to have those naps and timely naps. What is the nap schedule that we should follow? These regressions you have run us through. You have also run us through the safe sleeping strategy for little ones. Also talking about establishing a routine, and I think that is something that you have very asserted a lot, that we should definitely follow a routine when it comes to putting our little ones to bed. Yeah. So I think this has been an extremely helpful session, and I really thank you a lot for today's chat with us. I don't see any questions so far from the audiences, but I would encourage, if you do have any questions, even if you are seeing the live later on, and if you do have any questions, please drop them to us, and I hope that sir will be able to answer those questions for you, and we'll get back to you with the answers. Thank you so much, sir. We look forward again to get on more such live sessions with you, and utilize all your expertise.
Okay, thank you very much. Thank you for giving me this opportunity also. Okay.
Thank you. Bye bye.